Dr. Alex Earl, and it's Hump Day with Dr. Alex Earl here at Pure Plastic Surgery. Sorry I came on a little bit late today. Typically we start at 4:30, but I got a little delayed here in the clinic. But hey, we're still having Hump Day here for you guys today. Second Hump Day of the year. Super excited. And remember, this is the time we get to spend with you guys and answer all of your plastic surgery questions. We can talk about anything related to plastic surgery, any procedure, any topic. And you know that it's coming from a good source, a reliable source, because I am a Ivy League educated, Duke trained, double board certified plastic surgeon with over 12 years of experience and thousands of cases under my belt. Okay, so today we're going to talk about tummy tucks because I've been getting this a lot. This year, or actually towards the end of last year, we introduced our new signature tummy tuck, which is called the Smart Tuck. So we're getting a lot of questions about the Smart Tuck and how is it different. And then we've also been getting quite a bit of questions on the DMs and everything else about the reverse tummy tuck. So today I'm going to break it down for you so it's going to be super clear, super easy to understand. But of course afterwards I'm happy to answer any questions that you may have regarding tummy tucks or anything else in plastic surgery. Okay, so let's get started. Tummy tucks. So there are different flavors of tummy tucks, different types. And we're going to start with what is the most common one out there, which we're just going to call your regular tummy tuck, or some people call it your full tummy tuck. So regular or full tummy tuck, that is your tummy tuck. That's kind of your standard tummy tuck, and that's going to include, does include some liposuction. So it includes liposuction to the waist. And then of course the skin excision, so we're going to be removing all of the excess skin in that lower tummy area. And we are also going to do a complete muscle repair. So the muscle is going to be repaired all the way from the top near the xiphoid, or this area right here, all the way down to the suprapubic area. And this muscle repair is as little or as much as we need to do. And what do I mean by that? For most patients, when they have some muscle weakness or separation, either due to pregnancy or weight loss, typically it just requires that big double suture. It's a number 1 PDS for those who understand the terminology, but a big stitch that goes all the way from the top to the bottom. Okay, it's a double stitch, so it's kind of like you're doing 2 stitches at once, and that's sufficient for that muscle repair. Now there's some patients that require a little bit of extra. So on top of just doing the one that goes kind of from there all the way to the bottom, say these are the legs here, we can do what's called a triple plication. And so sometimes we can add some additional plication or muscle repair along the sides as well, if we need to like really kind of cinch in the waist a little bit more and flatten out the tummy. And so that triple plication can be done with a regular tummy tuck, and it can certainly be done with the Smart Tuck as well. Now, when you're doing a regular tummy tuck, you will have, of course, that scar, that lower belly scar. And I like to do it in a way where it's in a nice, like it's very, very low, but in a nice kind of gentle curve, kind of like a happy face, if you will. And you keep it super, super low in that nice gentle curve, so that it becomes really easy to hide in a swimsuit, in a bikini, and in your undergarments or underwear as well. Okay, so we're going to do that. I don't like, there are a lot of plastic surgeons out there actually that kind of make a cut that goes kind of straight across like this. I don't like that cut because it's very tough to hide. Maybe you can hide like the initial kind of middle portion of it, but if you're wearing any sort of like underwear, bikini, or swimsuit, the scar goes beyond where the swimsuit comes up, and therefore you're going to see a very visible incision or scar there. I don't like that at all. I think it's very tough to hide, so I don't do that. I do that nice curve here, and then of course we contour the waist. So this is not the kind of your grandma's tummy tuck where everything looks very straight. We're gonna contour that waist and make sure you have your curves. But it's limited, and so we've come up with our own signature version of the tummy tuck, and we call that the Smart Tuck, and it's actually trademarked. The little trademark sitting on there, so it's actually trademarked. So it is our proprietary signature way of doing the tummy tuck here at Pure Plastic Surgery. And so there are some differences from your kind of run-of-the-mill regular tummy tuck. And first of all, it certainly involves more lipo. So now we're not just lipoing the waist, but we're lipoing the entire flank and side, all the way from the armpit, all the way down. And we're also doing lipo to the axillary region in the front area here as well. So it helps contour that whole area. If you're combining this with a breast procedure that's called like your mommy makeover with your smart tuck, then that extra contouring in the axilla up here really helps accentuate the breast too, especially if we're combining that with like an implant or a lift with implants, okay? So it really contours the entire kind of front and sides all the way from the top to the bottom. And then for the abdominal portion of it, we are going to be adding some etching or high definition. So we have some high definition there for that beautiful athletic look, kind of that soft athletic look if you'd like. It can be soft, it can be a little bit harder, depends on what you want to do. But it creates those nice lines, the one in the middle, the ones along the side there, to give you that beautiful athletic look without losing curviness. So you still have the curves and you have that athletic kind of Pilates type of look, okay? And then to add a little bit more curvature, we're going to do some fat transfer to the hips. So that's really going to bring out that beautiful hourglass shape, okay? So we're going to bring out that hourglass shape as we combine the additional lipo with the HD and the fat transfer to the hips. Now you have that beautiful hourglass shape there from the front. Of course, we're going to tighten everything up. We're going to do your skin excision and your muscle repair like I talked about from top to bottom. We're going to start off with the one in the middle, but if you need additional plication, what we call that triple plication, we can do that at that moment as well. And you can add stuff to it, and importantly, you can act, if you really want to bring in that waist, and you're someone that has a little bit of flaring of those lower ribs, so ribs 10, 11, and 12, your floating ribs, then we can add some rib remodeling to this as well. So that's really going to bring in that beautiful, beautiful hourglass shape then. Okay, so if you're looking for a tuck that's curvy, then you definitely want to be going with a smart tuck, okay? And that's why we call it smart tuck, because we use our own proprietary technique. It's called smart aesthetics, and that's where we blend your underlying foundation with your desires and your goals, as well as your objective measurements and anatomy, and we blend that all together to come up with the best plan to come up with long-lasting, enhanced, natural, beautiful results. Okay, so that's our signature smart tuck, only available here at Pure Plastic Surgery. All right, and then last but not least, to talk about here today is what we call the reverse tummy tuck. And so a lot of people ask, why reverse? So your typical tummy tuck and your smart tuck, you're pulling down, right? So you're removing all the excess skin in the lower abdomen. You do dissect all the way up here, but then all that skin gets pulled in the downward direction towards the pubic area, okay? And your incision is in that lower suprapubic area. But there's times where most of the loose skin is not at or below the belly button, but it's actually above the belly button, okay? Typically, this happens, most often we see that after a liposuction procedure. So liposuction has become more and more popular these days. Actually, it is the #1 aesthetic or cosmetic procedure in the United States. So it used to be breast augmentation for a long, long time, many, many, many years. And in the past 2 to 3 years, now liposuction is #1 and breast augmentation is #2. And so we're seeing a lot more liposuction, and when we see that, we're seeing more patients that after their liposuction procedure, they're developing a little bit of loose skin in that upper abdominal area. And so when you have loose skin here, sometimes it bunches up beneath the breast, or sometimes it bunches up a little bit around the belly button, creating that kind of donut around the belly button. And so the best way to try to fix that, especially if it's anywhere from like moderate to severe, is to then pull up. And so we call that a reverse tummy tuck. And so the incision for the reverse tummy tuck is going to be just beneath the breast. So in what we call the inframammary fold, okay? So we're going to tuck that underneath the breast. We're going to hide it there. The one key thing you have to know is that for most patients, though, in order to really get a great reverse tummy tuck, the incision needs to go underneath the breast, but then it does cross the midline. So there's a little tiny scar around the midline here, just beneath the breast, and then across down to the other breast. There are some patients, but not all, okay? Some patients, but not all, where we can do it and avoid that little scar that goes across the midline. We have to do an evaluation. We have to see how much loose skin you have, where the loose skin is, to see if you actually qualify for that reverse tummy tuck where we don't cross the midline, okay? So, so yes, we're gonna have a skin excision, but it's in the upper abdomen. We're gonna hide that scar in the inframammary fold. We are gonna do lipo. We can actually do lipo throughout the entire abdomen if you'd like. We can do a lipo 360 if you like. So whatever you want to add on, we can do lipo to the abdomen, the waist, the flanks, potentially even the back. So yeah, that is something that we can add on with your reverse tummy tuck. And that's what I wrote here. You can add on further lipo, and actually this here too. If you want to add some rib remodel, you can add that to your reverse tummy tuck as well. Okay. So I hope that's clear. Now with the reverse tummy tuck, look what's not there. There's typically no muscle repair with the reverse tummy tuck. Okay. That's very important to keep in mind. So the patients that qualify for a reverse tummy tuck don't have a big separation or diastasis. So their muscles are pretty close together and the muscles are pretty, fairly tight. So typically no muscle repair with the reverse tummy tuck, and you're also not having a scar around the belly button because you're not really moving the belly button itself. You're basically dissecting only up to the area, the level of the belly button, and then pulling things up this way. Okay? All right. So I know I spoke a little bit fast there, but I hope all that is fairly clear, but I'm happy to answer any questions regarding tummy tucks or anything else.
In terms of tummy tucks, we have some questions about the scarring.
Yes.
What do you recommend for the tummy tuck scar?
So that's a great question because it is one of the things that people worry about, right? So a lot of times we get the question like, hey, do I need a lipo or do I need a tummy tuck? And I'm like, you really need a tummy tuck because you have a lot of loose skin and your muscles are separated and weak. And then they're like, well, doc, but I'm so scared about the scar. Okay, listen, if you had 1 pregnancy, 2, 3 pregnancies, and you have all this weakness where you're standing and you're pooching out like this and the skin's all wrinkled up, let me tell you, your tummy's gonna look a lot better with a nice little thin scar on the bottom than the way that it looks now. Okay, that's number 1. And that scar, that little thin scar, that kind of in that natural curve that I like to do around the bottom, is going to be very easy to hide in your swimsuit, even in a small bikini. Okay. And the other key is your belly button. I make really natural belly buttons where I'm hiding the incision towards the inside, so it's not so visible from the outside. Okay. So yes, we have to treat the scar, and so what I recommend to treat it is a silicone-based scar cream. The one that we like to use here is called Silogen. And you're going to start using that twice a day for at least the first 3 months, okay? And if we notice that there's a little bit of the scar getting thick, like hypertrophic or keloid, then we want to get on top of it early and inject it with a steroid called Kenalog to also help flatten it out.
If I'm booked for a tummy tuck and breast lift,
yes,
and now after seeing this, I want the smart tuck.
yes.
So what should she do in this?
What you need to do is contact your coordinator here at Pure Plastic Surgery. Let her know that you saw the live and that you want to do the smart tuck. And guess what? I just came up with this. I hope they don't kill me back there. But if you tell them that you want the smart tuck and that you want it because you just saw this live here right now in appreciation for you guys coming on that live, I'm gonna give you 10% off. The difference for that smart tuck right now. Okay,
right.
So thank you so much for coming on live. Thank you so very much for being active and answering the questions. And you just got a 10% off, the increase for the smart tuck right there and there. All right, that's my gift to you.
All right, well, we have a comment to that.
Okay.
Anything for BBLs?
Anything for BBLs. Well, I'll tell you how it works here at Pure Plastic Surgery. If you haven't booked yet, right? And you are ready to book. You're like, hey, I've seen Dr. Earl. I saw his live. I really like the way he does things. If you call us and you're ready to book that day, then yes, you will get you will get a discount that day. You get at least 10% off, maybe a little bit more. I don't know, depending on the date that you choose. Okay. So, but you have to come prepared. You can't be like, hey, I'm just figuring out information. Let me call you back in 3 weeks. That's not going to work. Then you're going to get full price. Okay. But if you have you've gathered all your information, you're ready to put down that deposit, you do the deposit the same day, yes, I will give you a discount.
All right, nice. Well, there we go. Next question. I am scheduled for a mommy makeover, and my worry is to have fat left over above the belly button and on my sides due to 1 liter of fat limit. Can you please advise on this?
Yeah, so, there are some patients, and I don't know that this is particularly your case, okay, but there are going to be some patients that are going to benefit from a second procedure, a liposculpture procedure after their mommy makeover or after their tummy tuck, in order to really remove as much fat as we can, given the limits that we have here in Florida. So these limits are handed down to us by the Florida Department of Health and the Board of Medicine, right? So all surgeons in Florida must abide by these rules, and if they're not, they're just breaking the rules, okay? But the limit is that if you're doing a tummy tuck or a big incision like a breast lift, you're limited to removing only 1,000 cc's of supernatant fat via liposuction. So typically, that's enough to be able to do like what we talked about with the smart tuck. So we can do the waist, we can do the flank, we can do the axillary region, okay? And that's when we can do all that and really sculpt you and bring out those lovely curves, okay? But typically, it's not gonna be enough for us to be able to do like your entire back and the entire kind of abdomen area, okay? And so then in that case, then yes, then go ahead and have your mommy makeover, because I always recommend doing your tummy tuck first, okay? So have your mommy makeover, and then if we absolutely need to, then we may need to do a lipo 360 afterwards, okay? But what I can tell you is that with a smart tuck, we can reach more areas. We can reach the entire flank, the axilla, and the abdomen. We're not doing the whole abdomen because I want to make sure that the skin here in the front, we're not traumatizing it too much. We don't want to create problems like skin not healing well or dying or open wounds, right? So you want to be careful. Safety is our number one priority. So we're not going to be doing lipo in this area, but we're just going to be doing a little bit of etching there. And we can do some abdominal lipo up to about here and just underneath the breast here as well. So you may fall under that category. And so if you have the question, just write to us, let us know, and we'll see, what's the best option for you.
Can I do a tummy tuck if I have celiac? And if so, how many massages would I need?
Yeah, typically having celiac disease is not an issue. It's not something that's going to prohibit you from having surgery in our office-based surgery setting. Of course, we are going to require your labs, and we are going to require a medical clearance from your primary care provider. But as long as all those things pan out, then you should be good to go. Was there a second part to that question?
Yeah, how many massages?
Yes, how many massages? So for tummies, we typically recommend to start with at least 10 massages. Okay, and then see, take it from there, see how you do. That's a little bit different for like the liposculpture and BBLs. For those patients, we recommend a minimum of 20 massages.
Can you do a smart tuck as part of your mommy makeover?
Yeah, certainly. So, and I think I mentioned it here, but that's one of the beauties also of adding this axillary lipo like all along here. When we do the breast part of your mommy makeover, it really accentuates that breast very, very nicely. And also, of course, adding the additional lipo along the sides through here as well. So I highly recommend it, kind of upgrading to the smart tuck when you're doing your mommy makeover, because not only is your tummy gonna look even more fabulous, and you're gonna have those beautiful curves and that enhanced natural athletic look, but also the breasts are gonna look even better as well.
I have capsular contracture. One breast is high, hard, and deformed. Are there any effective treatments other than surgery?
So once you get to that point, and it sounds like you have what's called a grade 4 capsular contracture. So when the breast is deformed and it's painful and it's very, very hard, that's like the most severe degree of capsular contracture. And once you have that grade 4, really the only treatment is surgery, is to go back in and to remove that capsule completely. And most likely, probably the best thing to do is also to change the implant. So you would need an implant exchange and a total capsulectomy.
Can I do a tummy tuck with type 1 diabetes?
Yeah, certainly. So type 1 diabetes in and of itself does not bar you from having surgery. What bars you from having surgery is what's called uncontrolled type 1 diabetes, right? So if you're not taking the insulin the way you're supposed to, if your sugars are fluctuating up and down like this, if you're having frequent infections or other issues because of it, then of course, then you're not going to be ready. But if you're a type 1 diabetic, you take care of yourself, you take care of your medications, your insulin, your hemoglobin A1C level, which is a lab that we check, is steady, typically somewhere around maybe 7 or so, and you have clearance from your primary care doctor, then yes, you are still a candidate for a tummy tuck or any of the other procedures that we do.
How long do you have to wait to get a tummy tuck after postpartum?
So you're going to want to wait a minimum of 6 months, okay? You do have to give your body time to bounce back from the pregnancy. We have to see exactly how those muscles are going to do, because of course with the pregnancy the muscles are like fully stretched out, but in some patients they actually bounce back okay, especially if you're active during your pregnancy, and unfortunately in some other patients they don't. So we want to see how things kind of bounce back, how the skin's going to do, how the muscles are going to do. And so when we do, and then, you know, that takes about 6 months, and then we're going to have a much better baseline to know where we're starting.
I booked.
What's that?
I booked, so this is she commented above about switching. So she said, I booked Mommy Makeover for April and a BBL for August. Do I still qualify for the Smart Tuck?
Yeah, certainly. So you said Mommy Makeover in April 1st, is that right?
Yep.
Yeah, so definitely we can do the upgrade then. And then, of course, and you can keep everything else the same.
All right. Can you do a reverse and mini tummy tuck at the same time?
Reverse and mini. Okay, that's the key. So can you do a reverse and a mini, which I didn't really discuss here today, but can you do a reverse and a mini? And the answer is actually yes, you can do that. Okay? So what's the difference between the mini and say your regular tummy tuck? So when you're doing a mini tummy tuck, all you're doing is removing a little bit of the excess skin, so that little pooch below the belly button. That's it. So that's all it is. It's a skin excision. So mini is only skin excision, okay, of that lower skin below the belly button. It does not involve the big dissection and the muscle repair and everything else, okay? So if all you have is a little bit of loose skin below the belly button and some loose skin above the belly button, then you can combine the two. So you stretch a little bit down this way, a little bit up this way, get things fairly flat. Remember, you're not doing muscle repair with this though, okay? So, because if on top of that you have muscle separation or weakness, then that's probably not going to be the surgery for you. Then you're just probably going to need just your regular full-on tummy tuck or smart tuck, okay? But if all you have is just a little bit of loose skin down here, a little bit of loose skin up there, your muscles are nice and strong and they're fairly close together, then yeah, you could combine your reverse and your mini.
So this is another to comment to that. So confirming, you will do a Smart Tuck and a Mommy Makeover?
Yes, definitely. Okay. We can definitely add that to your Mommy Makeover.
Another one is, will you do a tummy tuck and BBL at the same time?
So that is the one thing that I don't do. So I do not combine a tummy tuck and a BBL, okay? Why is that? I have multiple reasons, but the most important reason is that here at Pure Plastic Surgery, we are known as, safety is our #1 priority, and we are known as the safest clinic down here in South Florida. And why is that? Because we don't do things like that, like combining a tummy tuck and a BBL. When you combine a tummy tuck and a BBL, the risk for complications goes significantly higher, okay? What type of complications? Major complications. For example, the risk of bleeding and needing a blood transfusion goes up significantly higher. More dangerously, the risk of blood clots goes up significantly higher. Okay, and I'm talking about clots in the legs, what we call DVTs, or clots in the lungs, what we call a PE. And a PE can put you in the hospital, in the ICU, or even death. Okay? So that's the primary reason why I don't like to combine a tummy tuck and a BBL. You all have heard about these cases, right? People go to the Dominican Republic, they get everything combined, and they do their BBL, they do the Mommy Makeover, they do the breast, they do all these things. They have a 6-hour surgery, they get a PE, and they die. And it's, they separated out the surgeries, that wouldn't have happened. All right. Second reason is because here in Florida we have limitations, like I just mentioned before. So when you're doing a tummy tuck, you are limited to removing only 1,000 cc's of fat via liposuction. Most patients, 90% of patients or more, are gonna have more than 1 liter of fat in their entire trunk area. So now they're gonna get a less than ideal liposculpture, they're gonna get a less than ideal fat transfer. So you're paying all this money to get not great results, okay? Your recovery is gonna be a lot tougher because you have to be on your back, and so now you're gonna be putting pressure on your buttock and hips, and yeah, you can have your cutouts and your mattresses and everything else, but you're gonna be putting some degree of pressure there. So now your fat loss is going to be higher. So why are you going to combine it, right? Your risk is higher, complication rates are higher, your results are going to be worse, your fat loss is going to be worse. It makes no sense. Okay? Separate out the procedures. It's safer for you, and you're going to get better long-term results. And when you do that, do your tummy tuck first. So do your mind makeover or tummy tuck first, come back 3 months later, do your liposculpture and BBL.
Thank you. All right, we have a few minutes left, so we
Okay.
need some rapid fire.
Oh, we're going
I
rapid?
have a lot
Okay.
of questions here.
Let's go.
What would you recommend first, BBL or tummy tuck?
Tummy tuck first, always.
I booked a skinny BBL with you, but my form only says lipo. Is that lipo 360?
Yes, so if it's a BBL, liposculpture 360, and Vaser, and Cell Saver, all included. Don't worry about that, it's all part of the package.
Will lipo remove a seroma post-op 4 years tummy tuck?
It's possible that it can do that, depending on the seroma, how thick the walls are and everything else. But if it's kind of a thin wall seroma, sometimes with lipo, the fact that we're just going through it multiple times, we'll be able to reduce it, or remove it.
How many liters can be removed with lipo 360?
So here in Florida, again, it changes by state, changes by country. Here in Florida, the max that we can remove is 4,000 cc's, or that equals 4 liters. So 4 liters of supernatant fat.
How long after my tummy tuck do you recommend I start massages?
So after your tummy tuck, your first massage is going to be the next day. You're going to start as soon as the next day. The first maybe 4 or 5 are going to be daily, and then you can probably spread them out after that for a minimum of 10 to start, and then we'll see where you're at.
If I get a mini tummy tuck, can I go back and do a regular tummy tuck for muscle tightening and skin tightening?
Yeah, you certainly can. So you're not burning a bridge. So say, for example, maybe you just had your first pregnancy and you did pretty well, but you had a little bit of loose skin there, but everything else kind of bounced back and you want to do a mini tummy tuck. Great. So you come in, you do the mini tummy tuck, you're a good candidate for it. But then after that, you get pregnant again. Well, typically what happens with the second pregnancy is that, unfortunately, you don't bounce back as well. And so you end up with a true muscle separation or weakness and even more loose skin, in which case then yes, after you're done having children, you can come back and do your full or regular tummy tuck.
All right, I had a tummy tuck and now I have dog ears. What do I do about that?
So dog ears, they're annoying. It's not typically a big deal, but it's just when you have a little bit of excess skin towards the end of the incisions. I do try to avoid that, with every tummy tuck that I do. And the way to avoid that is to take the incision as far back as you need to avoid having excess skin at the end. However, having said that, if things are done, you have a little dog ear, it's usually not a big deal. You come back, we numb up the area with a local anesthetic like lidocaine. We remove that little bit of the excess skin and then close it down. So it's not like a big surgery, it doesn't require general anesthesia or anything like that. It's just something that can be taken care of very quickly with a local anesthetic, and you're back to regular life very quickly as well.
I'm 9 days out of my tummy tuck. I have redness on my stomach. Is this new stretch marks?
So if you're 9 days out, there's redness there. First of all, I'm going to say, make sure you contact your plastic surgeon. I'm not sure if it's us or not, but certainly reach out to them and explain what's going on and send a photo to make sure that it's not a concern such as an infection or something like that, right? So redness can be a sign of inflammation, but it could potentially be a sign of infection as well. So that's what would be my recommendation. Reach out to your plastic surgeon, talk to them, send a photo, and get their recommendations.
Can you do a smart mini?
Well, no, it doesn't really kind of work out that way in that sense. I mean, you could, let me see, how should I word this? You can combine several things with a mini tuck, because when you're doing a mini tuck, you can combine liposuction. So yeah, you could combine all the liposuction here, and you can also do HD lipo as well. So I guess the only thing that you're not doing is the muscle repair. Okay, but yes, you can do a mini with the lipo to the waist, abdomen, flanks, and axilla. You can do the HD lipo. You can do the fat transfer to the hips. You can add plus minus a rib remodel if you want to go for that smaller waist. So yeah, you can add all these things to that mini tummy tuck.
All right, a few more questions. Do you perform rib remodeling?
Yes, definitely. Not only do we perform it, we are pretty much the #1 clinic for rib remodeling here in South Florida, in Miami. I spent a lot of time training with some of the best in the world in this technique last year. I went all the way down to Bogota, Colombia, to train with Dr. Hoyos and the Oñate brothers and Hugo Aguilar, who are like the top people of ribber model in the entire world. And I brought all that knowledge back. We've done several cases at Pure, and if you're interested in it, I know for a fact that next week we have 4 ribber model cases already in the books. So we'll be sure to take some videos there and show you that as well.
Can getting a BBL affect my hip mobility?
It shouldn't. No, it should not affect that in any ways.
For the fat that is on the lower belly, on the extra skin that is getting removed, does that count towards the 1 liter of fat or no?
Typically no, because that fat we're just directly excising. So we're not doing liposuction to the area, we're just directly cutting it out.
All right, last question. What are the common reasons for capsule contracture?
That's a great question, and I'll be honest, I wish we knew the exact answer for that. But unfortunately, we don't know, we haven't elucidated, we don't know the exact mechanism of why capsular contracture happens. There are some more theories out there. One of them is that if there's a little bit of blood that's trapped around the implant after surgery, that can increase the risk of capsular contracture. The other theory is that if there's some what we call biofilm, so there's some degree of bacteria contamination, so not so much that it actually causes an infection, but there is some contamination that could potentially lead to capsular contracture. But there's also genetic components that are involved, and then there's also just kind of bad luck as well. But we have seen that in some patients that are more prone to, say, for example, inflammatory processes or keloids or hypertrophic scars, they may have a higher risk for capsular contracture. So all these factors come into play. I don't think it's any one individual factor, and that's why we haven't kind of really known exactly what caused it. And what would explain, for example, in most patients, they only get it on one side. So the other side is perfectly normal, and one side has it. It's why did that happen? Yeah, probably not the answer that you're looking for, but several things can be involved.
Thank you very much.
Okay. All right, everybody. That was a lively session. I like that. All the questions, a lot of rapid fire questions there. I hope this was very, very clear for everyone. If everyone's still watching, go ahead and take a screenshot so you have that there with you as well. Okay. And I look forward to seeing all of you next week on Hump Day with Dr. Alex Earl. I'll see you then. Take care. Ciao.